we just talked about what is leaky gut and, how the intestinal wall, lining can get leaky, and that's when all these toxins get into our bloodstream and in a way attack the thyroid. Now it can attack other organs, but since, I'm talking about the thyroid most of the time, that's how it causes Hashimoto's thyroiditis. So the causes of the leaky gut, it could be, bad dietary choices, environmental toxins, if we don't sleep well at night, too much alcohol consumption, the stress really affects our microbiome, and the presence of intestinal infections. So there are two tests that I use in my practice. First one is the food sensitivity test. So again, I've removed the patient information for privacy, but I wanted to show you an example of how it looks, what the results look like. So it's basically a blood test. And then when I receive the results, on the top, you can see the foods that the patient reacted to. And then below, you'll see the non-reactive results. So on the top, again, you'll see the foods that they reacted to, and it goes from 1+ or +1 to +4. When we get these results, I tell my patients that doesn't matter if you tested +1 or +4. All the foods that are present in red should be eliminated for 90 days for best results. So we put them on a 90-day plan where the patient removes all these foods. And I tell them the good news is the long list of foods, which you did not react to can be used in your diet. So don't focus on what you have to eliminate, but focus on what you can use actually. So with that said, they also provide a 4-day rotation diet. So based on your results, this is individualized for you. And they'll break it down, your proteins, vegetables, beans, fruits, condiments, beverages, and how you rotate the foods. So the plan is not to reintroduce the food in 2 or 3 days. You want to space it out and eat it like every 4th day in a way to, prevent developing more sensitivities actually. Now, when these results come, sometimes the lab will reach out to me and say that, I would suggest, they would suggest some further testing for this patient depending on their results. So in this case, this patient, they recommended a few tests. So we'll go over those. One was the subfractions for the milk. So how this helps is they'll break down the proteins like the casein and the other 4 on the right-hand side. So individuals positive for casein should not eat cheese, but in this case, she's positive for one of the proteins, the lactoferrin, and that is one of the proteins found in whey products. So this tells us that she should avoid the milk and the whey proteins, but she still can consume the cheese. So if we get the result and they say that, she cannot have any milk products, then she would have probably eliminated the dairy. But by doing the subfractions, we know that she can still eat cheese. So that's how this is helpful. Now, similarly for the subfractions egg, we can find out if the patient can eat egg white or egg yolk. Either one. In this case, she's highly reactive to both egg whites and egg yolk, +3 for both. So she should definitely eliminate eggs in her diet for the 90 days. Further, we also tested the anti-gliadin antibody. She was negative for that. This is to look for gluten intolerance. So, a lot of times when patients start eliminating, they'll eliminate 5 things like gluten, dairy, eggs, soy, corn, etc. So rather than going on such a strict, dietary plan of elimination, this food sensitivity test can actually tell you what you react to. It is personalized and individualized for you and your blood results. So that's how this test is helpful. And then I also use the second test for gut health. It's really important, and it's called GI map. So I wanted to show you an example report. And in this case, the first page basically checks for all the pathogens, so the bacterial pathogens, parasitic, and viral. The good news is that in this case, all of these were negative for this patient. Now, on the second page, we see the presence of H. pylori. This is a common thing I find in practice. When the presence of H. pylori is found, these are present in the gastric mucosa. Now, some amount of H. pylori is present. Basically, I want to start off by saying that our gastrointestinal tract is a host of trillions of microorganisms, which make our own microbiota or microbiome. Now, we don't want overgrowth of the bad bacteria. We basically want a balance of the good and the bad bacteria for good health, basically. But when there is overgrowth of certain type of bacteria, that's when the problems begin. So the H. pylori basically is related to gastric ulcer formation. Patients will present with eructations, acid reflux as symptoms. And since that's present in the stomach or the gastric mucosa, it'll interfere with protein digestion, because that is where the protein digestion happens. So we get to know from this result that she has H. pylori. And then she also has overgrowth of certain bacteria like bacteroids, bifidobacteria, or actually enterococcus. Now, you may have, if you have used probiotics on the labels, some of these names would be familiar. So, for example, when you're using a probiotic, if you already have overgrowth of some of these species, and if we are adding more of that, that's not going to be good for you. It's going to cause more of the symptoms, like more gas or bloating. And that's why, based on these results, we can actually individualize and see what your body or what your gut actually needs. Going to page number 3 of the same test, we see the additional dysbiotic or overgrowth of bacteria. So these are the bacteria we don't want to see growing in the gut. So you see the Bacillus species or the Enterococcus or Pseudomonas or Staphylococcus aureus. These are, should be present in some amount, but in this patient, it is in excessive amounts. And their presence over there is going to affect how she absorbs her foods. It'll cause inflammation in her gut. It'll prevent her from digesting her foods and assimilating her foods. And that is why it is important to get rid of it, because otherwise you take all these good supplements, you think you're eating a good diet, but nothing is actually being absorbed because all these microorganisms may be eating up your food or interfering with the absorption. So I hope it's making sense, why this kind of test would be helpful. Then further, it's looking at potential autoimmune triggers, which looks at, actually there are studies now that show the presence of certain bacteria that is seen through these test results can show that one is prone to a certain kind of a chronic disease. Like, for example, over here we see Prevotella. It's not high, but it's still present. That could indicate, a presence of autoimmune or rheumatoid arthritis in the future. So that was just an example, but there are studies now that show that presence of certain bacteria can, tell us what one may be prone to. And that's another reason how this is helpful. So in her case, you see fungi and yeast, like the Candida is negative, the viruses are negative. So it tells me that, why she's having the symptoms that she's having. Because she was a patient presenting with joint pains, fatigue, brain fogginess, So we could have just guessed, okay, maybe she has Candida or yeast infection, but this test helped us, know that it's presence of dysbiosis actually, or overgrowth of bacteria that should not be present. We also looked at parasites, and this shows that the parasites were negative, worms were negative. And then the latter part of this page also looks at the intestinal health. So it looks for a presence of fat in the stool, which was negative. It's looking at elastase, which is a pancreatic enzyme. If she's making enough of that, she should actually be making more. It should actually be more than 500. Beta glucuronidase, showing inflammation in her gut. And immune response, her immune response is elevated, to things that she is eating. So her immune system is kind of overactive. It also shows presence of zonulin. Presence of zonulin is a diagnosis of leaky gut. So this is the protein when it can, bypass that intestinal lining. The high amounts of it showing in the stool test tells me that the presence of leaky gut in the patient. So now I know from this test, that she has overgrowth of bacteria. It's causing, inflammation. She also has food sensitivities that we saw previously. This was the same patient's result actually for the food sensitivities. And now all of this is causing leaky gut. So the last page of this test shows antibiotic resistance. So this is a cool thing to know as well, because if there is presence of, severe infection, then sometimes we have to use antibiotics. And, fortunately, I have not been able or not have to use it. I've been able to treat these patients with natural botanical medicines, and it's been very effective actually. So, but this tells us if she has resistance to any of these antibiotics like fluoroquines or amoxicillin, tetracyclines, which is all negative. So if this is good information for her to know, because ever in the future, if she has to use antibiotics, she knows that she doesn't have any resistance to them. So that goes over, the lab results. So moving on to the second part of today's talk is the 4 R's approach. The 4 R's are remove, replace, restore, and repair. This is what we follow to help patients heal their gut lining. So what do we remove? So based on the testing we did, we remove the food sensitivities. I tell my patients, now, if we have to remove these foods, does not mean that, they have to remove these foods for life. Basically, they remove it for the 90 days. And after the 90 days are up, they start introducing 1 food at a time, or maybe 2 foods per week, and kind of keeping a track of how their body is responding. If they don't have any bad reactions, then they can, again, safely put that food back into their diet. We also remove infections. So based on the result, if they have bacterial overgrowth, I will probably use natural antimicrobials to get this removed from their gut. If there is presence of candida or yeast or parasites, then we follow those treatment protocols. So basically, we want to get rid of what should not be present and what should not be causing inflammation in the gut. Replace. So again, based on these results, like this showed that this patient needs some pancreatic enzymes. Basically, our pancreas produces the pancreatic juices or enzymes that digest our proteins, our fats, our carbohydrates, right? So it'll tell me like, okay, this patients may need enzymes to break down the food and absorb it better. Sometimes they lack HCl, which is important to digest the proteins, because our gastric mucosa produces the HCl, and that helps to digest the proteins. So if one does not have enough of this HCl, they are not breaking down their proteins in their diet. And then some people have the a lack of bile salts because their gallbladder may be removed. A gallbladder, produces bile, and it helps in digestion of fat. So, if we see, presence of fat in the stool or sticky stool in a way, those could be signs of not digesting the fats very well. And at that time, bile salts would be needed. Now, restoring the bacterial flora. So there is probiotics and prebiotics. And, I would recommend, there was a beautiful post on my social media today about what are prebiotics and what are probiotics. So I would highly recommend you to read it. And I also want to tell you that based on this test result, the GI map, I can basically help, identify what probiotics would be helpful for this patient. And then finally, how do we repair the gut lining? So for years, when this damage is done, for example, if the gut lining is damaged, the gastric or the intestinal mucosa is damaged, we want to repair it. So one of the common things that's used is this amino acid called L-glutamine. There are other mucilaginous herbs, mucilaginous meaning mucus producing. So if you cook okra, you would have seen, like when it's cooking, you see all this mucus production. So these herbs like okra, marshmallow, slippery elm, those are all soothing for your gut lining, even for patients who have reflux or acid reflux. These are great. Plantains is another one. DGL or deglycerinated licorice is something I use when there is damage to the gastric mucosa. There are some botanical combinations that I use. There is one by Designs for Health called GastroMend. So I use that for patients, with H. pylori. Okay, so I hope that you're enjoying the talk so far today. So we covered, the testing that I use, and we covered the 4R approach. And now we go to this topic called, what diet should I follow? This is one of the common questions that I get asked by my patients. And a lot of them have been talking about the quarantine 15, right? Being home, we've kind of gained weight. And same thing happened with me. I thought I was making good choices, but I think maybe lack of movement or just being at home, just being around the kitchen, I was snacking more than usual or eating leftovers from my boys' plates or whatever I was doing. I did gain weight. And I have been watching it, and I have been able to get some of this weight off. And in general, so many diets are available. There are patients who do good on paleo diet, keto diet, Whole30. So what is common between all of these, and what should we do, and what should we be eating? So last weekend, I shared with some of you, I was, at the IFM, or the Institute of Functional Medicine annual conference. I was attending it online, and I actually captured some of the slides from one of this great speaker. He's really good. He is a professor at Stanford University, and I'll show you some of his slides because they kind of correlate to, my understanding and the guidelines that I have in my book as well about what diet should I follow. So that's him, Dr. Christopher Gardner. And, this is how he started his talk by eat food, not too much, mostly plants. So this is something, that I, relate to a lot as well. You definitely want a lot of vegetables and whole foods in your diet. I tell patients, eat foods that look the same in nature and when you buy them. So basically you want to try and avoid all the boxed foods, right? Those are processed. So of course you want to shop, in a grocery store in the surroundings, but you want to avoid the aisles where there are preserved foods or boxed and canned foods. You want foods in its fresh form. You definitely want to have as less sugar as possible. You want to try to avoid processed and refined grains. But you want to add more vegetables. You want to get fruits. And if you want like a sugar, eat an orange, eat a mandarin. It'll be a nice pick you up food if you're craving some sugar, rather than going for a cookie. Have beans. beans and lentils, they really are food for your microbiome. Your microbiome, these bacteria and microorganisms, they need fiber. The beans will provide it great fiber. That's the food for your microbiome to stay healthy. If you do have fish, have seafood that is not high in mercury. So that is important. Healthy fish, like with healthy fat, like salmon is a good choice. Eggs, there is this common thing that if I eat eggs, my cholesterol will increase. That is not always true, because there is good fats and bad fats, and the eggs definitely provide you with the good fats. So some eggs are good for you. A great source of fats are nuts and seeds, Now, too much of fat is also going to cause weight gain. So if you're trying to lose weight, keep these two things in mind: less carbs and less fat. Less carbs and less fat. So, carbs also includes your sugar. So, don't add any additional sugars to your food. And when I tell my patients to eat nuts, it doesn't mean you eat like a bag of nuts. It's like a handful of nuts, sprinkle it on your salads, like raw pistachios, walnuts, almonds. And always remember to rotate your foods. That's the best way. That will help prevent, develop food sensitivities as well. So this is an example of a nice breakfast or brunch, right? So it includes your eggs. It's like your omelet with vegetables. You see mushrooms, spinach, peppers, tomatoes. You have some fruit along with it, which gives you your natural sugars. So this will also help keep your blood sugar in balance, and, avoiding the carbs, keeping the fats less. If you're trying to lose weight, it's also going to help you with that. So what does this picture show? Don't eat the same thing all the time, So this is a great, breakfast as well, like steel cut oats with blueberries, some kiwi. I see some bananas on it, some nuts on it. That's great. But if you keep eating the same thing all the time, that's going to, probably cause food sensitivities for you. So have these whole natural fruits, but always try to alternate that. Now, this is a resource I have, and if you would like a copy of this, just send me an email and I'll send you a PDF version for this. So the best way to do conscious eating is writing down what you eat. Diet diary in a way. But this is more than that, right? So this will if you fill this page out, it'll give you a whole week's worth of how you did, okay, with your breakfast, snack, lunch, snack, dinner. So I always tell patients it's a good thing to have 5 to 6 meals a day, 5 to 6 small meals a day. If you follow intermittent fasting, that's great. Say you have all of this between 10 a.m. to 6 p.m. So that's just an example. People do it in different ways, but giving your body rest, giving your digestive tract rest will help. Basically it helps. The intermittent fasting will help you burn that stored fat in the body, use it as fuel, and that's going to help you lose weight in a way. So conscious eating, write down what you're eating from morning to night. Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. And then if you're going to try and make bad choices, the thought that you're going to write it down will prevent you from probably making it. And you know what? Sometimes you just cheat, and that's okay. But if you did some cheating twice a week, that's better than every day of the week. So what I would do is make some printouts for yourself, at least for 4 weeks, and start writing down. And then you also write down how you're feeling that day, how your moods are, how much water are you drinking. That's important. How was your sleep? Did you have a bowel movement? How was your bowel movement? And then in the latter part, you'll see the golden hour. I tell my patients, and I mentioned this in my book, the 60 minutes or the golden hour Dedicate at least 20 minutes for your body to get some kind of movement, to break in a sweat, exercise, stretch, yoga, whatever you like. 20 minutes for your mind, for meditation, to just sit still and let the thoughts come and pass. Just breathe, just breathe, just breathe. And 20 minutes for your soul. Anything that inspires you, okay? It could be some inspirational reading, listening to some talks. YouTube has a lot of inspirational videos, whatever you like, TED Talks, but dedicate this golden hour or 60 minutes to yourself. It is your self-care, because if you feel good, everyone and everything around you feels good. So if you would like a PDF copy of this, I'd be happy to send it to you. Just send me an email about it. So with that, if you would like to continue this journey with me, do go and visit my website. It will also have, it has a place called Work With Me, and it'll take you to my calendar as well if you would like to book an appointment. Now, if you're interested in doing either of these tests, this is the GI map. I do provide consultation on it. And even being at home right now, you can do it, because this test kit to collect your stool can be shipped over to your home. And you would collect the stool sample. The instructions are there, and I would guide you as well. And then you send it out via FedEx. I get the results in about 2 to 3 weeks, after which we schedule a Zoom consult to go over your results, and then I provide you a treatment plan. So you can book this with me if you like. And the second one is the food sensitivity test. So I showed you the testing. That's by a lab called Immunolab, which you go for a blood draw. But these days, people don't want to leave their houses, and that's fine. I have this at-home kit. It's a blood spot test. So you can basically prick your finger, get some blood and, collect it per the instructions, mail it out again. I would receive the results in 1 to 2 weeks, and then that we would go over your results and put you on a rotation diet plan based on your results. So you can find out what foods you are sensitive to. So this price is actually all inclusive of the test and your consult with me. So it's a great deal at $199 right now. I also invite you to join my Facebook group called Feel Your Best Self. It's just where I want to, have a group of people. We can ask each other questions, share recipes, share health resources, and just help each other out. And now I want to thank you for listening to me, taking time out on a Saturday afternoon, evening to, be with me today. And I open this up for questions. So if you have any questions, please unmute yourselves. I'm going to stop sharing my screen so I can see all of you. All right. So I can see all of you here. And I'm happy to take any questions if you have and help you with that.
I have a question.
Yes, hi.
Hi. On the GI map, the consult with you is $150. How much is the GI map test?
Okay, so the GI map, they also bill insurance, and there is an out-of-pocket pricing. With insurance, it's $208. And you directly pay the lab. If you don't have insurance, it's $359.
And then the GI map was that there was several screens that you showed us. It was all of that part of the GI map with the parasites. And I mean, it's very inclusive.
Everything.
Everything.
Yes, the one that I showed you, it includes all of that. And this is the price with the zonulin levels as well. So they have GI map and GI map with zonulin. But I tell all my patients to do the one with zonulin because we want to find out the leaky gut. So it's $208 with insurance, that's the copay, and without insurance, $359.
Great. That sounds like a great, I mean, I've had autoimmune for almost a decade, but I've really been working hard on it. I've done the food allergy testing. I haven't done the same one as yours, so I like yours because it shows the foods on the top. You know, but I'm still having issues with, you know, gas and bloating, diarrhea, constipation, all that stuff. And I've been trying to pinpoint it. So it sounds like the GI map would be a really great place to try to figure out exactly what's happening.
I agree. I think it's a great way to, you know, look at your gut picture. Absolutely. Yes.
Okay, thank you.
Thank you.
Dr. Thacker?
Yes, Ellie. Hi.
Hi. Do you know if that is covered by Medicare?
That's a good question. You know, I do not know that. Do you have secondary insurance?
We do.
Okay.
We have Medicare Parts A and B, and then we have Mutual of Omaha.
Okay. What I would do, Ellie, is call them. The name of the lab is Diagnostic Solutions. If you Google them, you'll find them right away, Diagnostic Solutions, and the test is GI map. I would call them and ask them this question. And then you can let me know. And if you're interested, we can set you up with this.
I have had at least 2 or 3 food allergy tests, and I am doing the rotation diet right now, but there's still several issues going on, I think. And
Okay.
Jim and I were not able to hear the YouTube that you showed. I got part of the link.
Okay. I am going to share it with you. Can I email that to you?
Yes, you can. And
Okay.
I do keep a food diary, but I wouldn't mind having a copy of yours as well, because it goes into some other things.
Yes, absolutely. Yes, I would, you know, ask you to keep that for 4 weeks and see for yourself how you are doing. And I will email a PDF version of that to you along with the link. Yes.
Okay, thank you, Dr. Thacker.
Thank you so much. And thank you for joining me. I love having you guys here.
I am trying to encourage my daughter. I have sent the links to her.
Okay.
And I keep asking her, but you know, she has a little one, so I don't know if what she's doing other than taking care of him for sure.
I completely understand. Yes, no problem. Whenever she has time and she feels ready.
Dr. Thacker, hi. I have a question for you.
Yes. Hi, Supreet.
How are you?
Good, thank you. How are you?
Fine, thank you. Great session, by the way. So thank you for doing this. My question is that if I continue eating foods that I'm intolerant towards, you know, like egg yolks or casein based on the food sensitivity test, what is a long-term effect of that on my gut?
Yeah, so, you know, these are the things that you tested positive to. So they are constantly causing inflammation, right? So it's kind of probably increasing. If you have leaky gut, it's increasing that, you know, it's going to prevent you from absorbing the nutrients from the foods you're eating or the supplements you're taking. So if you're prescribed, you know, supplements to help you with something, they may not be getting digested or absorbed by your body. So it may not help you, you know, get better. So if there's something that's causing inflammation, like the food sensitivities, I would definitely, you know, avoid those so that we give your gut a chance to heal, because when that heals, you know, it affects your entire body and your symptoms. So it prevents chronic disease in that way.
Oh, okay. Thank you.
You're welcome.
So Dr. Thacker, I currently take a probiotic. So if I should decide to do this test, should I go off of the probiotic for a couple weeks or something, or do
Not
I continue
necessarily.
to take it?
You can, you know, you can take it that way. You can see with using the probiotic what is the reflection on your test results. So it'll, you know, tell us if that's helping your gut, if things are looking good or not. So you can, if you feel good on the probiotic, I would continue using it and then take the test so you can see for yourself how it is. Just like, you know, when, for example, like vitamin D, because there is like a chronic deficiency, like patients, you know, decide to go off of it and then do the blood test. then again, it's low. So it doesn't help, you know, to know if that is helping them or not. So, yeah. Well, thank you so much, ladies. Thank you for being here on Saturday. I'm actually here in Northern Arizona in Williams today. So we'll be back on Monday, just taking some downtime with my family, being outdoors and away from everyone. So, yes. So you guys take care. And my topic for next week is going to be the 14-day detox plan. So we are going to go into like, you know, why should we detox and how are we collecting the toxins from the foods and the environment, and what are the things that are essential to help detoxification, what are the foods that will help, etc. So if you know of anyone that may be interested, please let them know. I'll be posting on my social media and sending out an email with the information of the meeting. And I look forward to seeing you guys there. So thank you and have a great evening. Thank you. Bye-bye. Bye-bye.
Thank you, Dr. Thacker.
Thank you. Thank you for joining, Eileen.
Yeah.
All right. I sent you a chat. Did you see my chat?
Oh, let me see. I'm sorry. Thank you for letting me know.
I know they don't always show up.
Yes, yes. Sorry. I will also email this to you. Absolutely. Thank you so much.
Great. And if I want to do the GI test, I can just kind of email you and.
Yes, please email me.
Okay.
Absolutely. Yes. Okay.
Thank you so much.
Thank you. Take care. Bye-bye.
Bye.